Hello, my name is Dr. Dewan S. Raja. Today I will discuss about transverse myelitis. Transverse myelitis is a neurological condition characterized by inflammation across both sides of one level or segment of the spinal cord. This inflammation can damage or destroy myelin, the fatty substance that surrounds the axons and helps with the transmission of nerve signals or nerve impulses. And myelin is produced by the neuroglia called oligodendroglia in the central nervous system. When the myelin is damaged, it can lead to symptoms such as pain, weakness, paralysis, sensory problem, and bladder and bowel dysfunction. What are the causes of transverse myelitis? The exact cause of transverse myelitis is often unknown, so it is mostly idiopathic, but it is believed to be related to the autoimmune disorders, viral infections such as herpes simplex, varicella zoster, and Epstein-Barr virus, bacterial infections such as Lyme disease, syphilis, even tuberculosis, and also sometimes fungal infection like histoplasmosis or any other inflammatory disorder may be associated with transverse myelitis. Transverse myelitis is also possible as a complication of vaccination, although this happens very rarely. Other immune-related conditions like sarcoidosis, environmental factor, vascular disorder, history of spinal cord injury. Environmental factor, people exposed to certain type of toxic substances, vascular disorder that disrupt the blood supply to the spinal cord, and there may be history of spinal cord injury. But this transverse myelitis is a condition, it is a neurological disease that is mostly of unknown cause. Symptoms of transverse myelitis can develop suddenly. Entire day, the adolescent boy or girl or any other age group is okay. In the early morning, the symptom may be manifested. It can develop suddenly over the course of several hours, several days. It may include back pain, weakness in the leg or arms, sensory disturbance such as numbness, tingling or burning sensation, loss of bladder or bowel control, difficult walking, and paralysis. Diagnosis of transverse myelitis. Medical history is very important. Physical examination, recent illness, history of recent illness, vaccination, potential exposure to infectious agent or toxin. Neurological examination assesses both motor and sensory function, reflexes, signs of spinal cord dysfunction. Laboratory tests include blood test to check for signs of inflammation. It may be complete blood count, infection, autoimmune diseases, and specific infections such as herpes simplex virus or Epstein-Barr virus. Imaging studies, particularly magnetic resonance imaging of the brain and spinal cord, are essential for diagnosing transverse myelitis. MRI can detect inflammation, swelling, and other abnormalities characteristic of this condition. CT scan may also be used but are less preferred for imaging the spinal cord. Cerebrospinal fluid analysis obtained via lumbar puncture. It helps detect signs of inflammation infection, and autoimmune disorders. Elevated white blood cell count, elevated protein level, and specific antibodies may indicate transverse myelitis. So CSF study is also important. Okay, this is the transverse myelitis, inflammatory condition. It is not unilateral, it is bilateral. Both sides of the spinal cord is affected. Entire spinal cord surrounding part is affected. White matter, there is axons. Myelin will disappear from this side. So this is the spinal cord with degeneration. The inflammatory process in the spinal cord. Okay. So here is the problem here, and we are saying this is the kinking due to inflammatory reaction. Okay, this is the spinal cord. Here is the spinal cord. Treatment of transverse myelitis. Corticosteroid, very important. High dose intravenous corticosteroid like methylprednisolone reduce inflammation and supports immune response. Plasma exchange, plasmapheresis removes and replaces plasma protein of blood to eliminate harmful antibodies and immune factors. Intravenous immunoglobulin contain pooled antibodies from healthy donor to modulate immune response. Pain management, medications such as NSAID, opioid, anticonvulsant, and antidepressant help manage pain. Physical and occupational therapy improves mobility and function. Treatment of underlying causes, managing underlying conditions like multiple sclerosis, infection, or autoimmune disorders. Symptomatic management, addressing specific symptoms like bladder and bowel dysfunction, muscle spasm, and neuropathic pain with appropriate medications. Monitoring and supportive care, case monitoring for treatment response and complications. Supportive care include assistance with daily activities, psychological support, and patient education. Rehabilitation, physical therapy, occupational therapy, tailored rehabilitation program help patients regain function and independence. What is the prognosis of this disease? Recovery and improvement. Many individuals with transverse myelitis experience some degree of improvement over time, although the extent varies from person to person. Complete recovery. Some achieve full recovery, especially with prompt treatment of mild inflammation. Partial recovery. Other experience partial recovery related retaining some symptoms or disabilities. Chronic symptoms. Chronic symptoms like weakness, sensory deficit, and pain may persist despite treatment. Relapses. Autoimmune diseases cases may have relapses, leading to recurrent inflammation and worsening symptoms. Complication. Potential complications include infection, blood clot, pressure, we'll say inflammation, blood clot, pressure ulcer, mental health issues requiring prompt management. Individual variation. Prognosis varies on factors like age, overall health, underlying condition, and treatment response. And that's all about transverse myelitis. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.